Good morning, everybody. I welcome you all to the class on development of breast and lactation. At the end of the teaching learning session, the student should be knowing about the structure, development of breast during fetal, pubertal, and pregnancy. What are the changes you must be knowing, and how is this regulated? You get an idea about what is lactation, how is it regulated, and applied aspect. Breast is made up of ducts and alveoli with fat stromal tissue. It also has a myoepithelial component which helps in milk ejection reflex, which we had seen in actions of oxytocin. It's made up of nipple and areola. So there are multiple lobes and lobules which contains the acini, and these ducts are called as lactiferous ducts. What happens during the fetal development is during 6 weeks, bud starts developing along the lines of armpit and which extends to the groin, termed as milk ridge. Around 9 weeks, the milk ridge regresses to the chest, leaving two breast buds on the upper half of the chest. Secondary buds are also formed from primary buds. Ducts, acini, myoepithelial cells are formed from epithelial buds. Later, nipple and areolae are formed. During puberty, they remain rudimentary throughout life in males. In females, they begin development at the time of puberty and enlarge. The early development is due to fat deposition. Ducts begin to grow and branch. Fat and fibrous tissue, breast tissue, become more elastic. With each successive menstrual cycle, it undergoes further development to reach adult size at about 19 years. At the time of puberty, breast enlarge due to the action of estrogen and progesterone. Estrogen causes proliferation of duct system, whereas progesterone is responsible for the development of lobules, that is the alveoli. In subsequent menstrual cycle, further growth occurs and adult size is attained by the age of 19 years. Other hormones responsible for the development of breast are growth hormone, cortisol, insulin, thyroxine, and prolactin, which has permissive actions. Final growth of breast occurs during pregnancy in response to high circulating levels of estrogen, progesterone, prolactin, human chorionic gonadotropin, human chorionic somatotropin. Placenta produces large amounts of these hormones. Prolactin and human chorionic somatotropin have lactogenic action, that is milk producing effect. Prolactin secretion starts by the 5th month of pregnancy, which gradually increases, and peak secretion occurs at term. At term, estrogen level and prolactin levels are very high. The lactogenic action of prolactin, which initiates lactation, is inhibited by estrogen. So there is no milk secretion during pregnancy. Prolactin and estrogen synergize, they act together in producing breast growth. But estrogen antagonizes the lactogenic effect of prolactin. Prolactin always acts on estrogen and progesterone primed breast. Just before delivery, few ml of fluid is secreted by breast, which is called as colostrum. It contains no fat but is rich in lactose, protein, lactoferrin, oligosaccharides, antibodies, cells like polymorphonuclear leukocytes, monocytes. After birth, baby is protected by colostrum due to the presence of IgA, which is immunoglobulin A, which is absorbed by the intestinal mucosa by endocytosis. It provides passive immunity to the baby against infection till the immune system start functioning. So maximum development occurs during breast. The nipple enlarge and areolae become larger and pigmented. There is increasing branching of ducts with appearance of many alveoli. As we also, the estrogen plays a major role in development of the duct system of the breast and collection of fat tissue, and there is increased secretory activity and accumulation of milk. Factors which regulate breast development, as we had seen, estrogen causes ductal development and favors fat deposition and also enhances increased vascularity, whereas progesterone causes development of lobulo-alveolar system, which is the development of alveoli in the breast or the glandular system. It requires the presence of estrogen for its action. For alveolar development, the ratio between estrogen and progesterone must be 1:50. The other hormones which plays a role in the growth of breast which has a permissive action, are the glucocorticoids, insulin, growth hormone. Prolactin causes alveolar hypoplasia and causes formation of milk in a gland which has been acted by estrogen or progesterone, that is estrogen and progesterone primed breast. Prolactin also has a role in initiation and maintenance of lactation. Relaxin has a role in development during pregnancy. Placental lactogen promote growth and development of breast during pregnancy. So normally the development of breast during puberty is influenced by estrogen, progesterone, cortisol, insulin, growth hormone, and lactational during when the mother is nursing or during lactating. Cortisol and prolactin along with oxytocin are essential for milk ejection. During pregnancy, estrogen, progesterone, cortisol, insulin and growth hormone along with prolactin plays a role in the development of breast. What are the congenital anomalies during breast development? There can be polythelia, that is more than one number of nipples, or polymastia can be more than normal number, that is more than two, or amastia with the absence of mammary glands. What is gynecomastia? This is enlargement of breast in males is called as gynecomastia. It is common at the time of puberty. It is also seen in 75% of newborns due to the effect of maternal estrogens. So once again, it is excessive development of breast in the male, which can be physiological due to transient enlargement due to maternal and placental estrogen, which disappears in few weeks. There can be some amount of secretion which is called as witch's milk, seen in the first few days. During puberty, 75% of healthy baby, which begins 1 year after the onset of puberty and subsides in 1 to 2 years. Old age, there can be gynecomastia due to increased conversion of androgens and estrogen. So what are the pathological causes? Pseudogynecomastia due to obesity can result from adipose tissue accumulation in the breast. Drugs like estrogen and digitalis therapy, because cardiac glycosides have a weak estrogenic effect. An anti-androgenic like spironolactone, which is a potassium sparing diuretic, and cimetidine, which is a H2 receptor blocker. There can be hypothyroidism also and cirrhosis with unicornism. The pathological conditions are Klinefelter syndrome, HCG and estrogen producing, that is human chorionic gonadotropin and estrogen producing tumors of testis and legs, along with acquired testicular failure and androgen receptor defects can result in gynecomastia. So the next topic which is important as we came across pregnancy, parturition, the next is lactation. Lactation is the process of synthesis, secretion and ejection of milk. It involves two processes. What are they? Milk secretion and milk ejection. So milk secretion is initiation of lactation or lactogenesis and maintenance of lactation, which is also called as galactopoiesis. So what is lactogenesis? It begins during pregnancy. Limited milk synthesis occurs during pregnancy and formation of cholesterol, which we already discussed that it is rich in lactose, protein, lactoferrin, oligosaccharides and antibodies. And lactogenesis 2, that is during parturition. The onset of copious milk secretion, usually within the first 4 days of postmortem. This involves changes in milk composition and volume. So this is milk secretion, and there is lactogenesis, that is the galactopoiesis, which is nothing but maintenance of lactation. And finally, involution, which includes cessation of breast, the breast involutes with cessation of breastfeeding and withdrawal of prolactin. So normally, the hormonal regulation of lactation is whenever the baby suckles, it stimulates there are touch receptors around the nipple which are carried to the somesthetic pathway or touch pathway and stimulates the hypothalamus, that is, it initiates the release of prolactin from anterior pituitary and paraventricular nucleus of hypothalamus causes release of oxytocin by the posterior pituitary gland. Prolactin stimulates milk production or milk formation. Oxytocin causes release of milk from storage, that is milk ejection reflex or let down reflex. Finally, the milk supplied to the infant. So what is milk ejection reflex? Whenever baby suckles, it stimulates the sensory receptors of the nipple and the impulses are carried via spinal cord. These impulses are relayed to the paraventricular nucleus of hypothalamus, which stimulates the release of posterior pituitary release of oxytocin from the posterior pituitary, which causes contraction of myoepithelial cells, eventually resulting in milk ejection or ejection of milk. Sound and sight or the baby's cry can stimulate release of oxytocin. Emotions can be stimulated or inhibited, but a sympathetic activity causes inhibition of milk ejection. So if you can see here the three hormonal levels. So whenever we talk about the initiation of lactation and maintenance of lactation, from the 5th month some amount of fluid is secreted by the breast. After delivery, when placenta is expelled, estrogen and progesterone levels fall and the inhibitory effect on the lactogenic action of prolactin is removed. This is one mechanism of initiation of lactation. The rate of prolactin secretion is increased so much after delivery that it increases milk production. Due to stress of delivery, glucocorticoids cause secretion. Secretion is also increased, which can initiate lactation. Lactation is established only after 2 to 3 days after delivery in humans. You can see both the estrogen and progesterone inhibited, they are decreased, whereas with every time the baby is nursed or there is suckling, prolactin and the oxytocin are increased. So during maintenance of lactation, when the baby suckles the breast, the nerve signals are transmitted to the hypothalamus, which stimulates the anterior pituitary to liberate prolactin and increase persists for 1 hour. This helps in synthesis of milk for the nursing period. Even though the basal prolactin levels falls after 2 months of delivery, there is acute rise in prolactin levels during each period of suckling. This repeated acute rise in prolactin is very essential to maintain milk secretion. Other hormones like growth hormone, glucocorticoids, parathormone help to maintain lactation by providing glucose, fatty acid, protein, calcium for the synthesis of milk. Thyroid releasing hormone also stimulate release of prolactin. As long as the baby suckles, there is milk production and the rate of milk production decreases by 7 to 9 months. So, lactation includes milk secretion and milk ejection. Milk secretion is initiation of lactation called as lactogenesis and maintenance of lactation called as lactopoiesis. So, the first few days there is a very important secretion. That's the reason we always advise the nursing mothers to feed the initial fluid which contains colostrum. The first fluid produced during late pregnancy and few days after birth is called as colostrum, which is a thick yellow fluid which is having a high protein content, mainly globulin, which contains antibodies. It is the immunoglobulin IgA, lactobacillus bifidus factor. It also contains colostrum corpuscles, which is nothing but mononuclear phagocytes containing fat droplets. As I told you, it contains protein, lactose, lactoferrin, oligosaccharides. It provides protection to infant against infection. It facilitates the passage of first stool, which is called as meconium. The composition of human milk is it's around 100 ml. In 100 ml milk, the rate of secretion can be around 1 to 1.5 liters. On average, 500 to 800 ml of blood, 1.5 to 1 liters per day. The water will be around 88 ml in 100 ml. Lipids can be 3.8 grams, protein about around 1.2 grams, wherein the casein and lactalbumin ratio is 1:2. The milk carbohydrates are 7 grams, minerals like calcium, sodium, potassium and chloride are 0.25 grams along with vitamins. 850 ml of milk is secreted on an average. So the benefits of breastfeeding is it has a balanced, it contains nutrients which are which is very balanced and it has a high bioavailability. It enhances cognitive development due to antibodies. It's prone for less infections, less disease and less food allergies. For mother, it contracts the uterus, delays menstruation, it conserves iron stores, may protect against breast cancer, and it is convenient. It enhances the bonding between the mother and the baby. So, what is lactational amenorrhea? If the mother does not nurse the baby within 6 weeks the menstrual cycle starts. The mother continues to nurse the baby, there will be increased prolactin secretion, which has the following effects. It acts on the hypothalamus and inhibits GnRH, that is gonadotropin secretion. It acts on pituitary and inhibits the action of gonadotropin on pituitary, that is, it decreases FSH, follicle stimulating and luteinizing hormone. In the ovaries, prolactin antagonizes the action of gonadotropins on ovary by resulting in decreased estrogen and progesterone. That is what within 6 weeks the mothers menstruate once they stop nursing, or if they don't nurse, it continues to around 25 to 30 weeks in women who nurse regularly. It cannot be relied for birth control, but it is an ideal, it is an effective method of contraception. What is galactorrhea? The spontaneous secretion of milk from breast under non-physiological circumstances due to hypothyroidism and hormonal imbalance or due to tumor or the pituitary, commonly the hyperprolactinemia, can result in galactorrhea. The treatment is bromocriptine. There is one syndrome called as Chiari-Frommel syndrome. In some females, there is persistence of lactation even if the baby is not nursed or if the mother is not lactating. Here, galactorrhea, amenorrhea, and gonadal atrophy are seen with persistent prolactin secretion. There is no secretion of LH and FSH, and so there is no stimulation of gonads, resulting in anovulatory cycles. This condition is Chiari-Frommel syndrome. In pituitary chromophobe tumor, this condition is seen without delivery and in non-pregnant females. A milk-filled cyst that is a round, well circumscribed and easily movable with breast is called as galactocele. It occurs after cessation of lactation. Treatment is surgical, that is needle aspiration. Thank you.